Hello everyone, I am Dr. Archita Goyal. Welcome to Decode. Don't forget to like and subscribe. Let's decode together. Here we have a 2-year-old male child who presented with history of recurrent respiratory tract infections and cyanosis. Echocardiography was done for the child. The parasternal short axis views show a vascular tunnel which is arising from the right coronary sinus. CT angiography images show a vascular tunnel which is arising from the right coronary sinus, which is seen to track anteriorly, and then it takes an acute angulation. Thereafter, it tracks between the right atrium and the left atrium. It shows multiple dilatations and multiple stenotic areas, and thereafter it drains into the right atrium. This is a classical case of anterior type aorto-atrial tunnel, where we can see that the right coronary artery was arising from the tunnel itself. A very important differential that you can consider in this case is a coronary cameral fistula. So how do we differentiate between the two? So the coronary cameral fistula, unlike the aorto-atrial tunnel, follows the course of a normal coronary artery. As you can see, the vascular tunnel here does not follow the course of the coronary artery. In fact, we can see the right coronary artery, small thin right coronary artery arising from the tunnel itself. The second differentiating point can be look for the myocardial branches. A vascular tunnel will not give rise to myocardial branches. Thank you so much.